Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hello, everyone. Welcome to a new broadcast of Ask the Pediatrician Hour. I am Gbemisola Boyede. I'm a pediatrician and I'm the CEO Ask the Pediatricians Foundation. ATP Hour is brought to you by Ask the Pediatricians Foundation. At Ask the Pediatricians Foundation, we are committed to the health and welfare of all children globally, but especially in sub-Saharan Africa, where majority of our children still die from largely preventable causes. And we do this through our various programs, online and offline. So the program you're listening to is one of our online outreaches. We talk about important topics that have to do with the health of our children. Our focus is to promote and to prevent diseases so that we don't even need to go to the hospital in the first instance. We also do community medical outreaches, and currently we've started our schools first aid care project. We've started it this week, and our volunteers have been to schools in Plateau and in Ekiti State, teaching the students about basic first aid, and we're also giving them the first aid booklets. And so I'm sure you will see some of the pictures on our website and our Facebook group. And we will see, we're still going to go to many more secondary schools, and actually our goal is to go to all the secondary schools in the country. So we really appreciate you supporting us by donating to our account details. So you can go to our website at our global giving page, and you will see the links there for you to donate to this project. And if you're an alumni and you want us to visit your school and you want to sponsor your school for this project, please also get in touch with us on our email at askthepediatricians@gmail.com, or get in touch with us via any of our social media handle, and we'll be able to talk and work together. We believe it is important to catch the new generation young, and we want to make sure we empower them with all the information they need and give them this reminder booklet so that when there's a medical emergency around them, they know what to do. We believe that this will save a lot of lives, and that is what we do on Ask the Pediatrician, our foundation. So thank you so much for joining us today. And today I'm also going to be talking about something very important, because something wonderful, something laudable, something that we've been expecting happened this week in Nigeria, and something was launched, and that was the human papilloma virus vaccine has been launched, and it is now available for our girls. I know we talked about it previously, and most of us have been expectant, but it's now here. And so today, in the spirit of the series I've been handling on vaccine preventable diseases, I'm going to be talking to you about the HPV vaccine and cervical cancer. So I really want you to stay tuned and not go anywhere. So whichever platform you're watching on our Facebook page, Ask the Pediatricians Facebook page or group, or our YouTube channel, or which you're warmly welcome. And for those of you who are listening on Freshwords Radio or listening on Ask Dr. Gbemi ATP podcast channel, I also want to thank you for joining us today. You're going to learn a lot. And if you have any questions based on this topic or any topic that we've handled in the past, or even any other issues that has to do with the health of your children, remember you can always ask your questions. You can always ask the pediatricians by going to our Facebook group, Ask the Pediatricians Facebook group, and you can put your questions there. The group is open 24/7, Mondays to Saturdays. And the difference between our groups and any other social media group is that the answers you get in our group are from a professional perspective, from the pediatrician's perspective. And I know many of you have been beneficiaries of our group and testified on how having that platform where you can interface with our pediatricians and our professionals have been so helpful for you in raising your children and in maintaining their health. So feel free to always post your questions there, and we will be there to answer your questions. Of course, we encourage you that if your child is very ill or your child has an emergency, please do not wait on the group. You have to get to the hospital. But if you want to learn about health issues, or you want to know how to promote your child's health or what to do, you can always post that there, and we'll be happy to answer your questions. And we'll be very also happy if you can support us by sharing our videos and also inviting your friends to join our groups, follow us on all our social media handles, on Instagram, on YouTube, on Twitter, on Facebook, everywhere. Just follow us, and together we will see to the reduction of unnecessary and preventable deaths of children in Nigeria and Sub-Saharan Africa generally. Okay, so welcome to today's broadcast. And like I said, I'm going to be talking about human papilloma virus. Because it's quite a mouthful, I want to beg you to let me just keep it as HPV. So once I say HPV, I'm referring to human papilloma virus, and I'm going to be talking about it and why is this important, and why are we so happy that we have launched it. We saw the Federal Minister of Health of Nigeria, the First Lady, launched it, and even I saw yesterday the Lagos State's First Lady, who also happens to be a doctor, was there in one of our schools, and they launched it and giving the vaccines to our girls. And I saw some of our volunteers and moderators have given me feedback. Some of you have also asked questions. Is it safe for you to give this vaccine to your daughters? Because our vaccinators are going to the schools, to the churches, to the malls, markets, and everywhere. They are also available at the health centers to immunize our children. And I want to plead with us to take our girls for these HPV vaccines. It is available for all girls between the ages of 9 to 14. But for some of you who are skeptical and wondering why do I need to take my daughter, that is why we are having this discussion today, so that we understand why. And the most important thing that HPV vaccine protects our girls from is cervical cancer. Okay, so when we say cervical cancer, we're talking about cancer of the cervix. The cervix is the neck of the womb. Okay, so the womb, the uterus, it has a narrow neck, and that neck, we call it the cervix, and that area can get cancerous in women. We'll call it cervical cancer. And the cervical cancer is the number 4 most common cancer in women globally. So it's one of the most common cancers in women. Okay, well, WHO says that it causes about 604,000 new cases and 342,000 deaths in 2020. In other words, 50% of all people that have the cases are dying. So that is serious. So cervical cancer is a very serious cancer in women, and also a killer for women. And 90% of these new cases and deaths again happens for those of us who live in low and middle income country. You will know why when we talk about that, but I want to give us the key facts first, because we need to understand this cervical cancer and why it's so important for us to know about it. And why HPV and HPV immunization is so key, all right? Because majority of cervical cancers are, in fact, 95% of cervical cancer are due to this HPV infection. Okay, especially the type 16 and type 18. They are responsible for over 50% of cases of cervical precancers. So, and HPV is usually through sexual intercourse. Most people, especially once girls become sexually active, they can have HPV virus. And luckily, most people, when they have the virus, they will clear it. The virus will go away by themselves. But some people, it doesn't clear, and it will develop into cancer down the line. And there's no way we will know who is going to have it or who is not going to have it. So, which is why it's so important for us to protect our children. And the good news is that HPV acts a vaccine. So, this human papilloma virus, there is a vaccine. And with this vaccine, it is very easy to protect our girls against the human papilloma virus and by extension against cervical cancer. So cervical cancer is the most common of the human papilloma virus related disease. So that's why we can't talk about human papilloma virus and not talk about cervical cancer, because that is the most serious of all that virus can cause. Okay. And this HPV is the most common viral infection of the reproductive tract. And most of us who have sex at one point will be infected, both men and women, at one point in our lives. And people also get repeatedly infected. But like I said, the good news, most people will clear the infection, but some 10% will not clear the infection. And those are the people that will end up having what we call pre-cancer lesions. And if we don't pick it up on time again, pre-cancer may develop into cancer. Sometimes it may take up to 10, 15 to 20 years for this to happen, but that's for those who have good immune system. For women whose immune system already not optimal, then it can happen within 5 to 10 years. So that is the problem with cervical cancer. And so if we know the problem exists and we know the cause of that problem and we have the solutions to that problem, then women should not be dying from cervical cancer anymore, because we know that 95% of cervical cancers are related to HPV infection, and we know that HPV infection is very common. Most time people who have HPV infection, they don't even know they have it, but majority of people will have it at one point or the other in their lifetime, especially as soon as they become sexually active. And luckily, we also have a a vaccine against this HPV. Then there's no reason why we should not be able to get rid of our women having cervical cancer. So I really hope we have seen the link. This is the most important thing that you can sometimes you may want to do for your child, protecting them against cervical cancer in future. It is something we have to do, and that is why this HPV vaccine has now been introduced for girls between 9 to 14, and when they take this vaccine, then they'll be protected against cervical cancer. All right, so let's talk a little bit more about HPV. Like I said, human papilloma virus is the most common sexually transmitted infection anywhere, and it is the most common what we call STI, sexually transmitted infection, and it can happen like up to 43 million cases. Even in 1 year, in 2018, the CDC reported there were 43 million infection. It's common among teenagers and people in their early 20s. There are many different types of HPV. So there are some types, so it's one of those viruses that have what we call different serotypes. There are many of them, but it's not all of them that can cause health problems, but some of them can cause health problems. So luckily for us, the vaccine we have are for those that can cause health problem. And it is not only cervical cancer that HPV can cause, it can also cause genital warts. When people see something like this kind of swelling around the private area as well, their genitals. So it is very common. And HPV is usually most often sexually transmitted, okay, irrespective of the kind of sex that the person has, whether oral or vagina, it can spread HPV. And people who have HPV infection, they don't have signs and symptoms. They may not even know that they have it, okay, which is the problem with some of this infection. Because if it's some infection, like when people have COVID, they're coughing, they're having fever, they're having all those symptoms, then people know that they have it and then they try to avoid them. But for HPV, most times there is no symptoms. So, and the person who does not have symptoms can actually go ahead and infect somebody who has symptoms. But we all know that since we know it is mostly sexually transmitted, and it can happen even whether you are not in, you are being faithful to one person. You only need to be one person to see have HPV infection. Unfortunately, the consequence of this HPV may happen several years. And for girls, our main concern is the cervical cancer, which can happen, like I said earlier, 10 to 20 years after, So sometimes you don't even know at what point the person has gotten the HPV, and now the person is now having cervical cancer, which is why it's something we have to deal with. Like we said, it does not have symptoms, okay? And apart from cervical cancer, this HPV complication can also cause other cancers involving the genital, the private parts as well. And for those who engage in oral sex, it can also cause cancer of the throat as well, or cancer of the tongue or the tonsils. And cancers don't happen over a day or two or weeks or months. They take years to happen. And unfortunately, there's no way we are going to know those who are going to develop cervical cancer, or those who are not going to develop it, or those who are even going to develop any cancer at all as a result of this HPV infection. We don't know, but we know that anybody who has human papilloma virus infection, which is very common, can end up developing HPV. And this HPV, like we said, different types of it can develop to different kind of cancers. And there's no way we're going to know those who are going to have HPV related cancers. So we know people have HPV, but we will not know those who are going to have the cancer. Of course, this is more likely to happen in those who have low immunity, those who have what we call immunosuppressive illnesses. So immunosuppressive illnesses are like TB, tuberculosis, which I talked about last week, or it could be HIV. Anything that suppresses immune system makes that person unlikely to clear the HPV infection by themselves, which translates to the likelihood that those people are going to have the chronic form of HPV, and they are going to have the complication of HPV, and which is what we're talking about, which is the cancers. And for girls, especially for women, it is the cervical cancer. So that is HPV. HPV itself, nothing much about it, but it's just that it is sexually transmitted and anybody can have it. It's very common. It's the most common sexually transmitted infections. and down the line it can lead to cancer, which is the danger with HPV. So let's talk a little bit about cancer itself, then I will try and link the two together. Okay, so we said the cervical cancer in women is one of the most common cancers. There's a time that cervical cancer and breast cancer, they were almost like going head to head in terms of how common they are, and it's still so common. And a lot of women do die from cervical cancer. From some of the statistics I gave us earlier, you can see that almost, the half 50% of people with cervical cancers may not survive it. So it is a very, very serious condition, and it can happen to anyone, and you never know when it's going to happen. All right, though it's unlike most other cancers that tend to affect maybe older elderly women, cervical cancer affect young women. Okay, I remember having a patient who was 35, and when I was a nurse officer, she had cervical cancer. She just had 3 children, and we lost her. So it's so terrible. And she's just still so young. I mean, she's just a young woman. And so anyone who has a cervix can have cervical cancer. As long as you're a girl, you're a woman, and you have a womb, and womb that ends obviously with a cervix, which is the opening between the vagina and the womb, then you can have cervical cancer. So, like we said, but one thing we've now noticed with cervical cancer is it is very related. It is 95% of it is due to HPV. So that is why we cannot talk HPV and cervical cancer separately. We have to put them together. Nearly all cervical cancers are caused by certain types infection with HPV, human papilloma virus. Okay, and cervical cancer grows slowly, and sometimes it can lead to to death. So what are the symptoms? What are the symptoms of cervical cancer? The most common one is bleeding. So people who have cervical cancer tend to have vaginal bleeding. They may bleed on their own, or they may be bleeding after having sexual intercourse, or they may bleed even during their periods, or even after menopause. And sometimes the period will be heavy and all that. So those are the most common signs of cervical cancer. It can also lead to unusual vaginal discharge. It can also present with pain when having sex. Some people may also have back pain, and all that. So this or pain even in the tummy and in the pelvic area. So those are the symptoms people get. Unfortunately, there are other symptoms like fibroids, like endometriosis, that may also present like this. So people with fibroids also bleed, and they tend to also bleed frequently and all that. So sometimes you are not sure which one it is. So which is why if you are having any of these symptoms, please don't make assumptions. The best thing is to make sure you see your doctor so that we can check, and for all these signs of cervical cancer, because like I said, these symptoms are common. It can even happen with people who are using maybe hormonal form of contraceptives and all that. So don't take any unusual bleeding in a woman. Don't take it very likely. It's best to always see your doctor first, and then they can always check you, and they may want to, do what we call, they look at the service itself, and then they can do some tests to know the cause and confirm it, and then recommend appropriate treatments. So like I said, what's the cause of cervical cancer? HPV, and it is the high risk type of HPV, and people can get HPV from sexual intercourse, from skin to skin contacts of the genital area. It doesn't have to be something penetrating. Also from sharing sexual choice. So it can happen like that. And cervical cancer can happen to anybody who is a woman, but it's more likely going to happen in women under the age of 45. Those who have weakened immune system, maybe they already have HIV or AIDS. Those who have had multiple children at an early age. So when people start having sexual relationship early, is one of the risk, okay, because then they're likely going to have HPV infection, and then they're likely going to have cervical cancer, especially those who started earlier than 17. And also, there was some hormonal kind of therapy that people used to prescribe in those days, but which we don't do anymore. But if taken during pregnancy, it can also predispose people to cervical cancer, or those who have had cancers of the vaginal, the kidney, the bladder in the past. They are also prone to this cervical cancer. Okay, so the good thing about cervical cancer is that it can be detected early and it can be prevented, because we already talked about the fact that most of them are linked to HPV. So in other words, if we're able to prevent HPV infection, then we'll be able to prevent HPV related cervical cancer. That's number one. Number two, we can look out for the cervical cancer itself, and this is why we talk a lot about pap smear. Okay, doing it regularly, because we are looking for any abnormal changes in the cervix. So when there's going to be a cancer, it doesn't just start suddenly and becomes cancer overnight like that. There's what we call a pre-cancer stage, okay, where there is some abnormalities in the cervix and that we can see. And at that point, if it is picked up early, even before it becomes the full-blown cancer, it's completely treatable. In other words, they can be removed completely and the person will not develop cancer. So really, people developing cervical cancer is a tragedy, because if we're able to do all these things, the immunization, the cervical screening, pap smear, then we should be able to get it prevented or treated before we get to the full-blown cancer stage, when unfortunately, though we have some treatment like chemotherapy and all that, but it's almost too late, because majority of people will still die. All right. And so, but if the cervical cancer is detected, then we can treat it as well through chemotherapy and all that, depending on the stage where to speak, the earlier the better as well. All right. So, even though it is not like 100% certain, but we can prevent cervical cancer, we can lower the risk of having cervical cancer. And I think that's what I'm going to talk about for the rest of this presentation. So I've talked to you about human papilloma virus, which is just a virus, which is the most common virus that sexually transmitted infection. And then I've talked to us about cervical cancer, which is a consequence 95% of the time of HPV infection. So the two of them always go hand in hand. And of course, the girls were the one most affected. So what do we do? So how do we prevent HPV infection? How do we prevent cervical cancer? So those are the things that we really need to talk about. All right, so let's start with the HPV infection. So that's where the good news I shared at the beginning of my broadcast started. Okay, HPV infection is preventable. All right, so we have the HPV vaccine, and I'm going to take time to talk about the HPV immunization, which luckily for us in Nigeria, so many other countries they've been dealing with this. I mean, they've been giving their children HPV vaccine for years. I remember I have to pay for mine. I have to pay for it. Then we call it Cervical. So 3 doses that you have to take. But now government, is now making it available for us. So there are different type of brands of this vaccine, but still the same, and they all protect against the serotypes 16 and 18. And those serotypes 16 and 18 of HPV, like I told us earlier, HPV is not just one HPV, there are different type of it, and it's the 16 and the 18 that are the most notorious when it comes to causing cervical cancer. And so we have almost all the HPV vaccines available protect against this type that causes 70% of the cervical cancer. So there are different types, but the most important thing is that um, they are all protective against cervical cancer. So it is best for children, it's best that we take the HPV vaccine before we start having the HPV infection, which is why we're targeting the girls before they start having sexual intercourse. And this is why we're targeting girls between the ages of 9 to 14. These are pre-pubertal or pubertal girls, but hopefully who are not yet engaging in any form, because once you start having sexual intercourse, then your chances of having HPV infection is very high. So, but we want to protect them before they get to that stage. So that is why all girls between the ages of 9 to 14 should be immunized against HPV before they start having sexual intercourse. Of course, we really want our girls to, go to school and study and then get married and all that before they begin to, engage in with sex generally. So which is also part of the bigger picture, how we're taking care of the girl child and all that. So HPV vaccine is now available in Nigeria. It's available in your health center. Please take your children for the HPV vaccine. Okay, it is available and anybody can have it. Any girl between the age of 9 to 14, you can have it. Even we women, older women, ideally wish we can still have it, even though we should have had it before we start having our getting, pregnant, having children, and all that. So I'll talk about how we can protect ourselves against cervical cancer. We can still go for the HPV vaccine too, but some of us may already have been exposed to the HPV infection, so we may already started another journey. So maybe the vaccine may not be as helpful for us, but definitely for the girls who are 9 to 14, please make sure you take. And I always tell us one thing, most of us think the government is giving us vaccine for free, and we begin to feel like, should I take it? Should I not take it? Is this safe? Is it not safe? And they are giving us for free, but remember that those vaccines are not free and they are not cheap. Somebody is paying for it. So the government paid for them and you are getting it free, and it's an investment into the life of your children to protect them against HPV infection and protect them against cervical cancer. So please, the only thing we need to do is to take our children to the health centers, to the schools or wherever they're giving it, and make sure you give it. If you have a girl between the ages of 9 to 14, please make sure they go and take that vaccine immediately. People ask, is this safe? It is very safe. It doesn't cause any harm. Of course, there are no vaccine that doesn't have side effects. Most of the side effects has to do with the injection itself. So the children, where they give them the injection on their hands, they may feel a little bit of pain, which is not too bad. We just give them paracetamol for 2-3 days. It's going to go away. You can let them rest their hands that they gave the vaccine in, just like the COVID vaccine, the same kind of thing. There's nothing serious, of course, unless the child has reacted to vaccine in the past, but these are like very, very, very rare. So that's why if the child is sick and they're having fever or they're not well, then you don't want to take them for the immunization until they are well. But otherwise, there's really no no issue whatsoever. So before we used to give 2 3 doses, but now I think they are trying to even introduce just 1 dose kind of HPV vaccine that will not give you, so you don't have to keep going back going back. All right, so the one given in Nigeria now, I need to confirm whether it's a single dose or double dose, but usually when you go they will let you know whether you need to come back for it. And like I said, the most common side effect is just that swelling or pain at the injection sites. And all you need to do is to give them paracetamol for 2 3 days, you'll be fine. Some may have a little bit of headaches, some may feel like their body is aching them all over. Some may feel a little bit of dizziness. Some may feel as if they are sick or having like malaria kind of sickness, or they tire. But most of these are very minor side effects. Just let them rest, let them take the paracetamol. Within 2 3 days, they'll be fine. Occasionally, very, 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 very rarely, some people can react. We have what we call allergic or what we call idiosyncratic reaction. In other words, we don't expect people to react to the vaccine that way, but some people will just be so uniquely different and they may have that kind of severe allergic reaction. But those who give immunization, they are very trained. So usually when they give you immunization, they will tell you don't leave. So when you go to the health center or the hospital or wherever they're giving it, the vaccinators, those who are giving the vaccine, they're already trained to identify those who are having severe reaction. That's why they always say you wait 15 minutes before you go so that they can observe. If you are going to have that kind of severe allergic reaction, most of the time it will happen immediately. So we can quickly give you the what we call treatment for such allergic reaction. They know what to give you immediately and the person will be fine. But so just watch out for that. But like we said, it is very, 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 very rare for people to have those form of allergic reactions. Most of the side effects are the ones I mentioned earlier, and those ones just rest paracetamol 2 3 days. You'll be back to normal and as good as new, and they are now protected against HPV infection, and they're also protected against cervical cancer, at least to certain extent. Now, for those of us who are already advanced, we're already sexually active, we're already having children. For us, like I said, we may already have the HPV infection. So in terms of protecting ourselves, the most important thing is to diagnose and pick up any abnormal changes in our cervix early. And that's what we call screening or pap smear, cervical screening. We want to pick up any early signs of changes in the cervix that may be suggesting that's maybe cancer. This is what we call pre-cancer kind of changes in the cervix. So that is what is more relevant for we, the older women. Okay, those of us who are already married, having sex, having children. So for the girls, girls who are in school, the HPV vaccine. Those of us who are already married, cervical screening. We need to have regular cervical screening. Many of us, they will invite us to come. So now today is not just for the children alone. I'm also talking to us, the mothers. They will invite us to come for cervical screening. And we don't want to go. Please, it is so important that we go. Because like I said, a lot of women die from cervical cancer every year. Almost 300,000 women. That's a lot of women. And this is something that should not be killing anyone because we can actually pick it up. So in some countries, it is routine. They send you that letter every 3 years, then later every 5 years for you to come for your cervical screening. And your doctor will be on your neck to make sure you go. Everybody is put on the national register for it. I hope we'll get to that in Nigeria. But before we get to that, you better take responsibility for your own health, okay? It is so important to take responsibility. So, and there are always opportunities for us to have cervical screening, okay? So usually the easiest one is immediately you have a baby. When we go for our 6 weeks a postpartum check, they normally want to do a cervical smear for us. Please let them do it. Okay, those things, it's not really a long process. You just put in the speculum, look at the cervix, and just scrape, just put something there to take a little bit of the cells. It's not really painful. Of course, some of us may feel a little bit self-conscious, but it's a 1 minute, 2 minutes procedure. They just take a little bit of that cervix and send it to the lab. In the lab, they will look at it under the microscope and say whether the cells are normal or they are abnormal. If they are normal, they just tell you, good, check it again in another 3 years. If they are not normal, which may be signs of maybe some early cancer changes have started happening, what we call pre-cancer changes, then they will invite you back so that you can get your treatment on time. Because if we pick up screening at that time, before it becomes full-blown cancer, when we pick it up at what we call the pre-cancer stage, then we will be able to treat it, and the person will not develop cancer, and the person will be fine. So it is so important that the gynecologists, they have different method for treatment for the pre-cancer stage of cervical cancer. So they something they will do for you and you go home the same day. It's not a big procedure. It's not like chemotherapy. What they do is to more or less cut out all those cells or burn it off, using layman's language, and then they just take care of it so that you will be fine. Or they cut it out completely, they excise, they remove the part of the service that has that abnormal changes. So this is something they would do. There are different methods for which they do it. You don't need to worry yourself about all those medical jargons, but the most important thing is for you to make sure you go for your screening. So the question is, when last did you do your pap smear? When last did you do your screening? We should be taking our health seriously once you are in that age, because for us as pediatricians, we need you to be alive to take care of our babies. We need to take care of our children. So we want you to also take care of yourself. And unfortunately, cervical cancer, breast cancer, they take our women away. Today's about cervical cancer, so I won't go into the breast cancer. Maybe another day we'll talk about that. But the way to prevent cervical cancer: immunization, HPV, to cervical screening. You must do it every 3 years, at least until the time they say, okay, maybe it's every 5 years. Please, it's so important. Every time you have a baby, you must, at your postpartum check, you must go for your cervical smear, and don't forget, put it in your reminder, okay? It's something you can do in most of our government hospitals, and I don't think you have to pay for it. And some hospitals, some cancer centers all over the place, they do it, they offer it routinely, and it's available, and you can just go for it. So that way you'll be protected, and if there's any abnormalities, it can be treated. And if it is treated at that stage, you will not have cervical cancer and you'll be alive. Okay. And so that's why majority of our women dying from cervical cancers, they are dying from our low income, middle income countries, because we are the ones that don't have this cervical screening program. We are not taking it seriously. It's up to each of us to take ourselves seriously. But in other countries, it's routine. Everybody, they are asking you and reminding you to come. So we have to take responsibility for ourselves as well, so that our women will not be dying from cervical cancer. So I've told us what to do. And of course, God forbid, but if somebody already has cervical cancer, it is treatable. Okay, so I've talked about some of the signs. If you have irregular spotting, bleeding in between periods, some of us complain about the symptom, but we don't take it seriously. We just see it as no big deal, but it's a big deal because it could be sign. Of course, I'm not saying everything has to be cancer. There are other things that could cause it, but please, if you're bleeding after sex, you are bleeding in between your periods, or you have vaginal discharge, or it is smelling bad, you're having back pain, weight loss, poor appetite, and all that, please see a gynecologist. Okay, see a gynecologist. We don't want you to come to us at this point. We want you to come to us before this point. But if maybe you are just learning about it and you are seeing this sign, please still go to the hospital, and then they will be able to get you treated with chemotherapy and all that. All right. But I hope none of my listeners get to that point. The point is to come to us before you get to that stage. All right. So I've been talking for the past half hour on HPV, human papilloma virus, and cervical cancer. And I hope you have now seen the link between HPV and cervical cancer. And for my girls, which is the part that concerns me as a pediatrician, we are happy now that the HPV vaccine is now available in Nigeria and it is free. So I'm pleading and I'm leaning down. I'm begging you, please take your girls. I don't want to hear I have a girl between 9 to 14 and they've not been immunized. This is the time to do it, okay? This is priority. Take the girls now. Take them. If you don't know where to go for your immunization, feel free to ask us. I think it's almost all over the states, and I know it's now in Lagos. So please go to your health center, ask them HPV vaccine. And I know that somebody was telling me there's people are saying there are a lot of myths about immunization, which we have addressed in the past. But the most common myths in Nigeria, especially in certain parts of the country, is that maybe some people are trying to stop us from multiplying. They are trying to sterilize us by giving us this vaccine so that we will not have more children. That is not true. Okay, that is not true. I mean, we have been taking all these vaccines and we're still having our children, and our population is about 200 million now in Nigeria. So that is not true. So don't let anybody mislead you, or don't take any nonsense anybody is telling you, because there are a lot of fake people that say all sorts of nonsense out there. So the immunization does not sterilize you. It does not sterilize your girls. It is to protect your girl from HPV infection when they become sexually active in a few years down the line, and by implication protect them against cervical cancer. So it is not a population control mechanism. It is not sterilization. If you have any worry or any fear about immunization, please talk to the vaccinator. Talk to us as well. You are welcome to come to ATP. I thank you, those of you who have actually, I still answered a question yesterday on it. A mother was like, oh, is this vaccine safe? Yeah, it's okay to ask questions. On our Facebook group, we have the HPV what we call vaccine information sheets. If you ask for it, we'll also give it to you as well, so you can read about the vaccine, what the vaccine is for, and what it does, and all that. So feel free to ask us. I think I will pin it right now to the group so that you can easily access it. And if you still have questions, please ask. We are happy to answer your question, but please don't be scared. Feel free to take your children for immunization, no problem. And for you yourself, if you've not had your pap smear in the last 3 years, please walk into any general hospital, any government hospital, or any cervical cancer screening center, and ask them, do you do cervical screening here? Do you do pap smear? I would like to do one. Please do it. And I'm sure that together, yourself, myself, all of us, doing the immunization, doing the cervical screening, we'll be able to protect ourselves, our girls, our future girls and women from cervical cancer. And hopefully, no woman should die anymore from cervical cancer. I hope you have really learned a lot. But if you still have any questions, feel free to post your questions on Ask the Pediatrician Facebook group from Monday to Saturday. I will be there to answer your questions. So till I come your way again next time, next broadcast, keep sharing this video and make sure that you take all your girls for immunization, and you also go for your cervical screening. And remember to be part of our ongoing school first aid care outreach. Please support us. Thank you so much, and I will see you next week for another episode where we'll talk about something else that is so important today about the health of our children. Till then, it is bye from me, and have a wonderful day. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.